Our featured speaker is America's favorite oral surgeon. He is the author of the new book, 8 Secrets About Teeth Everyone Needs to Know. Please welcome a man I greatly respect and I'm proud to call my friend, Dr. Ted Grellner.
America's favorite oral surgeon is a bit of a tongue-in-cheek title because no one relishes the idea of going to an oral surgeon unless you need to replace an important missing tooth with a dental implant. Well, what's the chance that you may have to do this? American College of Prosthodontists tells us that almost half of Americans are missing at least one tooth. Pretty good chance you may need my services someday. Yet, many dentists and dental specialists will tell you that they can place that dental implant for you. So who do you go to? When you see the famous athletic brand swoosh symbol, do you also recall the slogan, just do it? When it comes to that missing tooth, do you go to a dentist to get your implant who can just do it? I mean, many will give it their best shot. And, you know, there are some that will actually do it very well. Does it matter? I mean, can't any dentist just put an implant in? Would you rather go to someone who can just do it or do it well? Well, let's take, for example, you want to hire an oboe player to do an important event. Do you hire a beginner? No, perhaps an intermediate player? Or maybe an expert? Well, you probably want the expert. And you would pay him a price that's commensurate with his ability to do it well because you're confident in the quality of the result that you would get. Well, how does this relate to a dental implant? Close your eyes and imagine you're laying back in a nice, comfortable dental chair that is soft, cushy, and leathery. With your mouth open, you can feel and smell the warm, gloved fingers of your surgeon resting on your numbed teeth. Positioning and repositioning that surgical drill, asking his assistant, Mabel, does this look lined up to you? Oh, yes, doctor, it is. And so for the next 30 minutes, they go about preparing your jaw and placing that implant, using little more than a 2-dimensional x-ray as their guidance. Now, several months later, you're going to your dentist to get that implant restored. Your dentist looks inside at your implant and gets a shocked look on his face, and then he quickly starts working. Well, it turns out he's going to have to do a lot more work to restore that implant than he had originally planned, and he's not at all happy about it when he delivers your final result. What happened here? Your implant was misaligned to the other teeth. The severity of a result like this can range anywhere from having to actually remove the implant and replace it because it won't hold a functional or a natural-looking tooth, to perhaps minor where it might need some minimal adjustment. Beginner, intermediate, expert, all differentiated by skill and precision. Who would you prefer? Someone who can just do it or do it well? Your dentist, jeweler-like skill and artistry is dependent upon the accuracy of your implant placement. So what if I could guarantee your dentist that as long as you have the bone to place the implant where he wants it, that I could place it there precisely? And if for some reason I fail, I would reimburse him for the cost of that he doesn't expect to have to pay for something that just doesn't work out well for him. Well, what's the chance of you getting a guarantee in medicine and dentistry like this? I mean, it's very little. How can I do this? I utilize the accuracy and the precision of specialized digital technology. I can place your implant virtually and align it 3-dimensionally on a CAT scan x-ray of your jaws, along with digital pictures of your teeth and your gums. From this, a computer will mill a surgical guide that will fit accurately to your teeth and will precisely guide the drills to the depth and angle that your implant was placed virtually beforehand. Sounds pretty futuristic, doesn't it? No more asking Mabel if that drill is lined up correctly. No more worrying about whether your implant may damage a neighboring tooth root, injure a lower jaw nerve, causing lip and jaw numbness. even perforating through the jawbone because you're using you're doing a three-dimensional task with little more than two-dimensional information. Guided surgery will place an implant not only more quickly, comfortably, precisely, and confidently, but your dentist will get the result that he planned for. Just do it or do it well. It's important to the function, look, and longevity of your implant. If I can guarantee you that I can do a perfect job for you, I will be not only America's favorite oral surgeon, but your favorite oral surgeon.
On behalf of the Business Expert Forum at Harvard Faculty Club, I would like to present this award to Ted Grellner for being America's favorite oral surgeon.